Yeah, I think that's another really good question. And for for a long time, I think women have been not an afterthought in bladder cancer, but there's bladder cancer is about 70% men, 30% women. Um, and so when you're taking if you're going to take a patient to surgery, whether it's just to scrape do a resection and scrape out part of the bladder or bladder tumor, or to remove a bladder, something major, I think we have not really done a great job of counseling women specifically. I'll talk a little more about the removing the bladder, because that's a big operation for women. And we ask, have asked women in the past and done some research on this, like, did anyone talk to you about the changes that were going to happen to your body, what it was going to be like after surgery, specifically for sexual function, which has been an area that there's been a lot of kind of push recently to look at, because we really, as urologists, have not done a great job of counseling women specifically on, hey, what happens if I take out your bladder and maybe I take out half of your vagina, and how's that going to affect your sexual function, your quality of life, how you feel about yourself. And we've pushed, I think we've pushed more, and in the urology community, at least, there's been a lot more talk about it and a lot more attention on addressing these issues preoperatively. And I think the big thing I take from all of it is, don't make assumptions about your patients. Like, your female patients, they might be old. That doesn't mean they're not interested in, in having sex, or that their body image isn't important to them. And I think that the psychologic component and the body image changes is, again, something we're starting to understand and talk about a little more. But I make a point to talk to all my patients about that ahead of time, because that's really what I've heard from my patients. So, well, yeah, like my vagina, you didn't take out all my organs. We're trying to preserve organs more. But my body image, like, I don't feel right about myself. I have a bag, like, it's hard. Things are just different. And a lot of times they're not prepared for that. And I do think from a provider standpoint, spending the time to at least bring it up. And then I direct a lot of my patients to actually the Beacon, which is the Bladder Cancer Advocacy Network, where I am right now. They have an excellent website with a lot of resources for patients, and I try to send all of them there to do some reading and find other, there are other patients on there that they can talk to and reach out to, and kind of find a community, which I think is also empowering for them. And the other thing, again, another difference that we have found between men and women when they have their bladders taken out is women have higher surgical complications. And it's because it's really, a lot of them are vaginal complications. That's an area where they can be missed, and men don't have vaginas, and so the surgery is different, right? It's a different surgery that they're going through. And so I think, as we've been talking more about sexual function, preoperative counseling, and potentially preserving a lot of the other organs in the pelvis, I think part of it from a sexual function standpoint is great and really important that we talk about it. And also, just from nobody wants to get readmitted to the hospital with a complication. I think as potentially, as we kind of modify our surgical techniques, hopefully we can start decreasing some of those complication rates as well.